demonstration video where I'm going to run through basically briefly everything that you need to be doing every day. So this is your new oral hygiene routine and how you're going to be brushing your teeth. We're going to go through manual toothbrushes, electric toothbrushes, TPs and floss and other sort of interdental brushes. But just remember that this is what you're going to try to be getting into the habit of doing every day for the next 28 days. And then each of the 28 days you'll get a little video that's just going to give you extra little bits and advice. So if there's something that comes up in these steps and you think, oh, she hasn't really gone into that in much detail, it's because we're going to talk about it. But I don't want you to focus too much on the real how we do everything. Just try to take as much as you can from it. You can watch the video as many times as you need to, and just try not to get too frustrated. Just set yourself some time at a different time of the day to do these things, because I think a lot of the time people might watch the video and think, oh yeah, I'll do that tonight just before I get into bed, when I watch that extra episode or two on Netflix that I shouldn't have, or I watched a film and now it's too late. You'll just be putting it off. So really, get yourself a cup of coffee, tea or whatever. Yeah, you're allowed to drink coffee. I'm not going to tell you off. It's not going to stain your teeth, because now you're going to know how to brush your teeth properly so the stain doesn't build up. So yeah, just have a nice little chill and just take what you need to from this video. So we're going to start off. So this 15 steps, and the first step is just to get into routine of brushing twice a day. I know a lot of people brush just once a day. If you want to be getting the most from the 28-day smile, of course, you can watch this and you can say, do you know what, I'm going to follow it all, but I'm only going to brush once a day. That's fine. You'll get half the results. So if you really, really want to invest in your smile and get the best from it, first step is to be making sure that you're brushing twice a day. So we brush in the morning to protect our smile for all of the foods and drinks and things that we're going to be eating throughout the day. We brush at night to remove the food and plaque that's built up during the day. Step number 2 is to stand up straight when you're brushing. A lot of people, when they brush their teeth, they get a bit of a gag reflex. So what you can be doing is standing up straight when you brush your teeth. And also, I don't brush. So the third step is to not brush in front of a mirror. You know where your teeth are, you know where your gum line is. Just try to get in the habit of not looking at what you're doing, because when you're looking at what you're doing, it's just making it harder for you. You know where your gum line is, that's where you need to put your toothbrush. Simple as. Don't overcomplicate things. Do try and stay in the bathroom. I think sometimes we try and do like other things. I know people, you can try and like one-handed doing your toothbrush, and then getting your children up and trying to do other things, getting your clothes ready and stuff. So it's a lot better just to sort of concentrate on toothbrushing. It's just 2 minutes. So apply your toothbrush. You want about a pea-sized amount of toothpaste. The toothpaste I use is Oral-B Gum Enamel Repair. I love this. You can use any toothpaste, it's fine. I don't recommend whitening toothpaste, and you need to be using 1,350 parts per million fluoride at least. There is a video on fluoride coming up. So just a pea-sized amount of that toothpaste. I always recommend, so tip number 5 is to always start your toothbrushing in the same place. So I always start bottom right. That's just where I place my toothbrush head. So then you're going to start forming a routine, because I got a demonstration model in surgery, and I ask people, how's your toothbrushing routine? And they just like start anyway. And I'm like, do you start the same place every time that you brush your teeth? Because if they're not, there's a danger that you'll miss places. So to get a really consistent, good brush, just start in the same place every day. So seal your lips around your toothbrush. So I'm going to give you a little demonstration now on toothbrushing. So when you're brushing your teeth, I take a pea-sized amount of toothpaste. You don't need anything too much. Some people launch on their toothpaste. You just need a small little pea size. So I'm going to place my toothbrush right at the back of my mouth, and seal your lips around your toothbrush, because a lot of people, they just have their mouth open, and that just means that your toothpaste is then going to spread all over your bathroom cabinet if you are in front of the mirror, and you don't need to be doing that. So yeah, when you brush your teeth, pop your toothbrush in. So that's using an electric toothbrush. It's difficult to see because you do brush your teeth with your mouth closed, but I will show you. So I've got an electric head here. So when you're brushing, you just want to make sure that you are angling your toothbrush, you're angling the brush down onto your gums. If you're brushing straight on, I'll show you this way. If you're brushing straight on, you're going to miss the spaces in between your teeth. Can you see you'll miss them? Whereas if you angle the brush down onto your gums, you're going to get in there far more effectively. I'll show you on the larger demonstration now. So if you're going to use a manual toothbrush, when you're using a manual brush, just make sure that you are brushing straight, instead of brushing straight onto your teeth, that you are angling. Always, whatever you're using to brush your teeth, you're just angling your bristles, okay? So it's really difficult to show on models. That's it, because you can see that you're completely missing the surfaces in between your teeth. Whereas if you angle it, you'll get in there a lot more effectively and clean a lot more efficiently and remove the plaque. So that's step number 8. Number 9 is just consistently make sure that wherever you're brushing, you're always reaching your gum surface. So you want to be cleaning the tooth surface, but also the gum surface. So that is, like I said, I start brushing down here. So I'm angling my brush and I'm cleaning down here. This is easier to see. So if you brush straight on, you're missing the spaces between your teeth. And if you angle it, you'll get in there a lot more effectively. So you need to clean the whole surface of the front of your teeth and all the surfaces inside. The same on the top and then also on the palatal side as well. Step number 10 is to make sure that you're also brushing the biting surfaces of your teeth. Now this, you'll find that you've got like fissure patterns in here, that we call them, on your occlusal surface, the biting surface of your smile, and you need to make sure that you are brushing that effectively, because that's one area that plaque and food will stagnate. So number 11 is to make sure that you're trying to consistently brush for 2 minutes. Now I say trying because a lot of people, the average brushing time in the UK is about 45 seconds. It's gone up a little bit, it used to be about 37, but it does need to be 2 minutes, and that doesn't matter how many teeth you have. In fact, it needs to be at least 2 minutes. So if you are someone that's had quite a lot of dental work and you've got quite a lot of fillings and other sort of things, then if it takes longer than 2 minutes for you to effectively clean your smile, then that's fine. You need to be careful that you're not over brushing. And the pressure sensor on the electric toothbrush, I did try to show you in the demonstration video, I don't know if you could see. So this is the blue light that I've got it on. If I'm putting the right pressure on, then it'll go green. If I press too hard, then it'll go red. So that's fantastic. If you have got an electric toothbrush, when you're brushing, do try to utilise the pressure sensor, because they are fab. So number 12, after you've brushed your teeth, spit out and leave it. Don't rinse with anything. Leave the toothpaste to carry on working. We'll talk about mouthwash and other things in a couple of days' time. Just consistently try to brush your teeth, spit out, and then leave it. A lot of people like to rinse after, and they like to use mouthwash. Just don't. Just brush your teeth, spit out, leave it. No water, no mouthwash, nothing. Number 13 is to just, then you rinse your toothbrush. So when I'm putting my toothpaste onto my toothbrush, I don't have any water at all, and then you don't need any water running. I just, once I've done brushing my teeth, I rinse my toothbrush off under the tap and then just leave the toothbrush to stand upright to dry. So then flossing, this is number 14. So my favourite is the Oral-B satin tape. I refer to it as floss, but it's tape that I use. And I take a nice long bit of tape, okay? Wrap it between your middle fingers. The tighter you have this, the easier and the more control you have. And the idea is to make a C shape around your tooth surface. So take it in between your teeth and then make a C shape. So I'm going to put it on my front teeth so you can see this a bit easier. So I've got a nice long bit, wrap between your middle fingers so it's really nice and tight. Take that So you can see there I was sort of angling and trying to curve the floss, the tape around that side. So if that's, imagine my thumb is a tooth and you want to try and anchor that floss, because if you're just going to use this straight in between the space, you're only going to clean the contact points. Whereas if my thumb was a tooth and I'm angling that tape and getting in between, then you'll see that it's going to contact the curves of the tooth as well, and you'll get a lot more thorough clean and effective clean from that. Now, number 15 is the last one. So you can use your tape where your teeth are narrower, but where spaces are a little bit larger. You may have seen these brushes. Now, these are interdental brushes, and they are fab. They do come with a little handle that you can also use. They come with a top, a lid, but you can also use as a handle, which is fab, so they can make them extra long. If you want to bend these to use them further back, then that's fine, but what I would suggest is just leave that bent, because you find that if you sort of straighten these out and then bend them again, then they can become a lot more brittle. They're not a throwaway item, so you can use these. I use these for quite some time. You'll notice when it's time to chuck them out, when, you know, way before the bristles start to come away. But some people throw them out after every use, and there's no need of that. I know that the thought is not very nice, that it's got plaque and bacteria on there, but you can just rinse them under the tap and leave them to store exactly the same as you would your toothbrush. They do come in an array of different sizes. There's 9 different sizes. These are some of the larger ones. So they do come quite big. Now that is quite a large space TP, but if you've got like a tooth missing and you find it difficult to clean either side of where you've got a tooth missing tooth, then they are fab, and you need to use these. So I'll just use a little red one. You just take them in between your teeth, take them back and forth a little bit. If you try and place them right down low where your gum meets the space in between your teeth, you'll find that they get in a lot easier. Sometimes people panic a bit because they take them up the space, so they just find that they just don't go through. You can try and practice this in a mirror, but I would try without also, because you might find that you can just like feel the spaces. Whereas if you look in a mirror, the tendency is to see the place that you want to brush, pop it in between, and then just go at it a little bit too much. And there is a little wire part in here, and that can sometimes irritate people's gums, and then that just puts you off. They're going to bleed when you first start using them, possibly, if you're not used to using them, and you've got any inflammation. We will cover all that, but just first of all, as we're going to start going through these, just follow them 15 steps. You can watch this video again, like I said, and try and get comfortable with using these little bits. It's just practice. So yeah, and I'll see you over the next 28 days. Bye.